It says the same thing. Well,
I'll get done in 29 minutes.
okay. Hi, my name is Lauren. Are you going in to see this patient?
Yeah, I'm going into room 231 to see Shanae O'Connor. You want me to tell you a little bit about her?
Yeah, I'd love an S-bar.
Sure. So Shanae O'Connor is a full code. She's on universal precautions, so we're just going to make sure we wash our hands and wear gloves when we deal with her. She has an allergy to sulfa drugs. She was admitted to the hospital for a fever of unknown allergies a few days ago. Her history is diabetes mellitus and end-stage renal disease and recurrent urinary tract infections. She is on a renal disease diet with 1,500 milliliter water restriction. She wears glasses. She's been a diabetic for 26 years. Her blood glucose was 155 this morning at 7:30. She's been complaining of a pain of 4 out of 10. She does have an IV in her right median vein. She's been complaining also of general malaise, decreased appetite, and increased blood glucose levels. She has a history of an AV graft with no complications, a 10-pound weight gain over the last week, numbness and tingling in her lower leg she's reported, as well as a decreased urine volume and frequency, and urine has been darker and more concentrated, and a fever of 101.1 degrees. She has pending CBCs, blood metabolic panels, and a culture and sensitivity of her urine. Her urine has been cloudy, amber in color, with white blood cells of 15 per high power field and a few red blood cells noted. The pH was 4.7, the specific gravity was 1.005, which is the low end of normal. So I'm going to go in and hang some normal saline and some imipenem and cilastatin IV medications, if you'd like to watch.
I would love to. Why specifically is the client receiving that medication?
Well, imipenem is a beta-lactam antibiotic, and cilastatin is added to help protect the body from the antibiotic. So the imipenem is rapidly metabolized and can cause toxicity of the kidneys, and the carbapenem actually prevents it and protects the kidneys.
Awesome. What action does the medication have on the body?
Well, imipenem is mainly bactericidal. It inhibits the third and final stage of bacterial cell wall synthesis.
Okay. When should you question administering this medication?
You should question administering this medication if they have an allergy to this class of medications. You should also question administering this medication if they're currently pregnant, because it can cause a heterogeneity of the fetus.
And does the medication have a therapeutic serum level?
There's no therapeutic serum level, but we do monitor their complete blood cell count, their liver function test, and their creatinine and their BUN.
Okay. And which vital signs must be monitored?
We want to monitor her temperature to make sure the fever is going down or staying the same and not raising. We also want to just monitor her other vitals to make sure she's not having an adverse reaction to the medication.
Okay. And which physiological parameters should be monitored when the medication is being administered?
You want to just kind of monitor her IV site, monitor her skin, make sure she's not developing a rash, monitor her respiratory rate, make sure she's not having any anaphylactic reactions.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
This medication is not administered at home unless it's intramuscularly, so we'll be administering it here in the hospital. But we want to make sure she's well aware of the side effects and that she reports them if she notices any. We also want to make sure she doesn't have any anaphylactic reaction, and she's aware what an anaphylactic reaction is, kind of swelling of the throat, rash of the skin, stuff like that, and she reports that immediately.
Okay. And what are the side effects and potential adverse reactions?
She could have some abdominal pain, she could have diarrhea with blood in it, she could have chest pain, she could have nausea, she could have a decrease in urination, she could have vaginal itching or discharge.
How will you know the medication is working?
We would see her white blood cell count lower, and we would notice her fever lower as well.
Okay, awesome. Can I watch you hang the medication up?
Yeah, of course.
Okay.
Hi, Miss O'Connor. I'm Lindsay. I'm going to be your nurse today. We have Lauren, a student nurse, who's going to be following us. Hi, Lauren.
Hey.
I'll wash my hands here real quick. How are you feeling today, Miss O'Connor?
Okay.
That's wonderful. So I have some IV fluids that I'm going to hang for you today. I also have an IV antibiotic that the doctor's ordered that we start. It's imipenem and cilastatin.
Okay. Is that for my fever?
That's exactly for your fever. So the first thing that I'm going to do is I'm going to just check your IV site. Have we noticed any pain or discomfort at the IV site?
No.
Okay.
She got it on the first try too.
Good for her.
Yeah.
I can see why everyone's been having trouble with these gloves lately.
They look a little small.
They do look a little small. I think I've got larger hands than these gloves fit. That's okay. Alright, so I'm just going to get my flush here, get an alcohol swab. And can I verify your name and your date of birth?
Shanae O'Connor, 10/31/1981.
Excellent. And Miss O'Connor, do we have allergies?
I have allergies to sulfa drugs.
Okay. See that here. What kind of allergic reaction have you had to the sulfa drugs?
Just a rash.
Okay.
So nothing too bad, but I don't want to get that rash again. That was not
No,
fun.
I can't say I blame you. That doesn't sound fun. So I'm just disinfecting the catheter here. And I'm going to flush through some saline, making sure that I can feel it flushing through. Do you feel any pain or discomfort?
No, just a little cold.
Okay. And the next thing I'm going to do here is I'm going to get your fluids hung. So I'm just going to scan your wristband again, if I can verify your name and date of birth again.
Shanae O'Connor, 10/31/81.
Okay. So I've got Miss O'Connor's file pulled up. I see her name here, Shanae O'Connor. And we are getting sodium chloride 0.9%, 30 milliliters an hour. So I've got my sodium chloride. I see that it's in date. I'm just giving it a gentle squeeze to make sure that it doesn't leak. And I see that it's not discolored or cloudy. So I'm going to get my line here. And my pen. My line's got a little attachment to it. There we go. Alrighty. So the first thing I want to do is make sure that my line is clamped off, and it is. So next I'm going to sterilely spike the bag. I'm going to remove this cap, remove the cap from here, and making sure it doesn't touch anything else, insert it until the bag is spiked. I'm going to hang up my bag here. I'm going to fill my drip chamber, and I'm going to flush my line through. Okay. Put it in, load it in the machine here. Machine always gives me problems. Start from square one. Everything looks good. I got a nice air bubble right there. Okay. door's not shut. There we go. Sometimes you just have to start fresh and new, Miss O'Connor. So now I'm going to swab your port one more time before I hook up your IV fluids. Look like you're ready to go to sleep, Miss O'Connor.
Mm-hmm.
They're very comfy beds.
Should be trying to wake up. It's the morning, right?
It is. It's 8 o'clock in the morning, Miss O'Connor. That's okay. You're allowed to sleep in. Sleep is a luxury here in the hospital. Not everybody gets. So I'm going to unclamp this here and turn your pump on. All right, yes, this is a new patient. Yes, this is a medical surgical floor. All right. Okay, channel select. Oops, I hit the wrong button. Let's go back. Channel select. Guardrail IVs. And this is 0.9% normal saline. Yes, this is correct. And we are running the rate at 30 milliliters an hour. And this is a 500 milliliter bag, so I'm going to hit 450. And I'm going to start it. I'm going to watch it for a minute to make sure it runs through. Looks like it's going. I don't hear it beeping. Okie dokie. I'm typing in that we're running this in 30 milliliters an hour in the right medial IV. I'm saving that. Okay, and next we're going to hang your drugs here. We're going to hang your imipenem. So I'm just going to scan you again, Miss O'Connor. Now I know we have the allergy to the sulfa drugs, but this is a different class of antibiotics. So you don't have to worry about, having the same rash as before. Now we do want to keep an eye out on a rash because we've never had this antibiotic before. We want to make sure that we're not allergic to this drug as well. So if you have any nausea, if you have any rash, if you have any diarrhea, if you're feeling short of breath at all, just let us know, okay? So I'm verifying this drug in this computer. I have Miss O'Connor here in the computer. I'm giving this little bag a squeeze to make sure it's not leaking. It's still in date. The imipenem cilastatin. I'm going to scan that right here. I'll spike the bag. Remove one cap. Remove the other cap. Stick it in. Make sure I'm clamped off. I'm going to prime my line. Okay. Clamp it back on. machine right here. I'm going to swab this port. I'm going to hook it up. Alright, and then we're going to add a secondary infusion. So it is imipenem, carboxylistatin. So A, B, C, D, E, F, G, H, I, J, K. Here it is, imipenem psilocybin. And we are running it at 500 milligrams per 100 mils. Should actually hit the... There we go. Yes, 500 milligrams and 100 mils is correct. So go ahead and hit next to continue. And I'm going to run it over an hour, so I'm going to select the duration to be 60 minutes. I want to make sure that everything is unclamped here. Okay. Hit start. Make a note here in the computer. Make sure I see a couple of drips go down in the drip chamber. Alrighty, Miss O'Connor. Was there anything else that I could do for you? No. Alright, well, I'll come back and check on you, okay? Alrighty. Did you have any more questions?
Yeah, I just have a couple more.
Okay.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I did check her IV site, make sure it was patent. I did check her drug allergies, make sure she didn't have a drug allergy to this class. So that's what I checked for.
Okay, and did this information affect your decision to administer the medication?
I did decide to administer the medication because her IV was patent. The doctor ordered the drugs and she has not had any reactions to this drug in the past.
And did this information affect how you administered the medication?
The instructions were to give the medication IV, so I went ahead and gave it IV since, like I said, her IV was patent and it could go ahead and go that way.
All right, well, thank you. Can I watch you document?
Sure. Yes, you can.
Thank you.